From the studios of KPCW in Park City, this is Cool Science Radio.
Science and technology that's accessible and entertaining.
If we can understand it, you can understand it.
I'm Lynn Ware Peak.
And I'm John Wells.
Joining us now is neurologist and sleep expert Dr. Chris Winter, who has written a book called The Rested Child: Why Your Tired, Wired, or Irritable Child May Have a Sleep Disorder and How to Help. Winter identifies the signs and symptoms of the most common sleep disorders affecting children today and empowers patients and caregivers to understand the steps necessary to address and treat their children's sleep problems, from common issues such as we know, too much screen time and night terrors, to narcolepsy, sleep apnea, and more. Dr. Winter, welcome to Cool Science Radio.
Thank you so much, Lynn. I appreciate that.
Well, it's really great to have you. You know, you've written, you are a sleep expert, and in our minds, maybe it's just from an adult perspective, we think it's all of us adults who have sleep issues, but you're introducing this world of children. I mean, you're not introducing, we know that it's out there, but tell us why you decided to focus on children.
So I'm a neurologist, but I just see adults and kids with sleep problems. So kids who can't sleep, adults who sleep too much. And it's an interesting perspective to be in a clinic where you'll talk to a 36-year-old woman who said she's been a bad sleeper since she was in middle school. And then your next patient is an 8-year-old. And so that kind of back and forth. I had written my first book called The Sleep Solution about adults. But the longer I kind of was in this sort of environment, the more I thought that when you mentioned sleep book and kids to parents, they'll say, oh yeah, I had this great book I used when my kids were little to help them get on a schedule and sleeping through the night. That you quickly realize that the entirety of sleep in kids when it comes to books is how to train your baby to sleep. And to me, once your baby's sleeping through the night, that's the beginning of the sleep process and the journey, not the end of it. And so if you're a mother of 9-year-old twins who struggle to sleep, or a 12-year-old who's just been diagnosed with ADHD that you think might be a sleep disorder, there really is no resource out there for you. So that's why I wrote the book. I really wanted to give a true sleep expert's opinion and perspective on sleep in kids from the time they're born till the time they have to college. So parents would have that resource to arm themselves with the information and understand their kids' sleep better and how to fix problems when they arise.
Chris, how much can we implicate screen time in all of this?
I think you can implicate it a lot. I think the two biggest threats to a kid's sleep are technology and school. And I say that with both my parents were middle school, high school teachers. My wife's a teacher. I love teachers and schools. It just presents itself with a barrier that sometimes can be problematic with school start times and things of that nature. And now we've sort of taken this technology piece and sort of integrated it with school, so that, you know, in my generation, if you had, we didn't have cell phones. We had I had a massive red phone in our kitchen with a cord that would stretch from one side of the house to the other. And you were constantly like laying the cable through the dining room out to your bedroom so you could talk to your friends in private. I mean, that was it. And we had a television. So this idea that now kids wake up, go to school on a computer, entertain themselves on a computer, dealing with club meetings on a computer, they really can't get away from it. And it's built to sort of feed upon pediatric dopamine. I mean, it's built to be addictive. And so when kids start to substitute time outdoors or time exercising or being around other people for more screens, more video games, it becomes devastating when you look at what the effects on sleep.
If you're just joining us on Cool Science Radio, welcome to the program. We're speaking with neurologist and sleep expert, Dr. Chris Winter. He's written The Rested Child: Why Your Tired, Wired, or Irritable Child May Have a Sleep Disorder, and How to Help. And the book certainly does tell you how to help. It's not just a, something you pick up or have at a university class. There's a lot of good information in this book. Dr. Winter, in the last 50 years, we've learned so much about what happens during sleep. We've also learned about the different conditions that interrupt sleep. And, you know, it may be that sleep disorders 50 years ago were called by different names, or, you know, we've just learned so much about this. Do we know the relative percentages of children affected by sleep disorders today versus in 1970?
That's difficult to know because, like you said, I mean, they were sort of a lot of times back in the 70s, and still today, a kid with a sleep disorder might be labeled as being anxious or might be labeled as being depressed. So they're getting a diagnosis, just not the right one. I think the statistics from today are saying if you are the parents of children, your children are 2 out of 3 kids are going to have some sort of sleep disorder between the time they're born until the time they head off to college. So these are massive numbers. In fact, I'm often amazed if I talk to a kid, you know, it's in some situation and they say, yeah, I'm 19 years old. I've never had a bad night of sleep in my life. Like, well, that's interesting. Like, wow, how did you do it? Because that's very much the minority. So these numbers are overwhelming. And then when you look at the numbers in terms of the doctors who are supposed to be identifying these disorders and treating them, there's a very good chance that the doctor that you're seeing with your kid has had next to no training in sleep disorders, which again wouldn't be a big deal if this was 1%, 3% of kids, something rare. They're not. They're among the most common complaints that parents and kids have when they take their kid to the doctor. So that mismatch that we had even before the pandemic created what we call a hidden sleep crisis. And now it's just absolutely exploding.
We love quizzes on this program, and you give us a little quiz at the front of the book, the 17, 18 true or false questions. One of those questions is, kids in school need at least 10 hours of sleep every night. I was thinking about that when I almost said true, and then I thought, you know, I think he's probably going to say false, but I wanted to ask you, why is that false?
So it's false for a couple reasons. The main reason is that we have to be very careful when we assign a number value in terms of sleep need. So I think that is a true statement if you're saying some kids or even many kids may need as many as 10 hours of sleep per night. We run into problems both with kids and adults when we start using a number, 8 hours of sleep in an adult, 10 hours of sleep in a kid, and automatically assume that's what they all need. It's kind of like saying all adults need to consume, 2,800 calories a day. That might work very well for an average adult. I don't know, but if you're a steeplechase runner, or you're an elderly individual who's somewhat disabled and just basically sits in a chair all day long, those caloric needs may be way too high or way too low, depending on who you are. But the problem, we don't think about sleep in that way in this country. It's you better get 8 hours or you're going to get dementia and have a heart attack if you're an adult. And one of the things I explore in this book is the genetics of sleep that your child has inherited from you and your partner, that dictate how much sleep does your child need, when is the best time for them to get it, and what do they do and how do they perform if they don't. And when you look at 2 toddlers that are the same age, their sleep need can vary by as much as 8 hours. That's an entire adult's night of sleep. And so the other thing I explore a lot in the book is sleep identity. We can imagine if you have 2 twins and one needs 8 hours more sleep than the other, you might be tempted to label the one who sleeps more the good sleeper and the one who sleeps less the bad sleeper. Well, Jimmy doesn't take naps very well and he struggles and fights us when we put him down. Now, Susie, man, she sleeps wonderful during the naps and she goes right down. And what we're basically saying is we value the kids that sleep more because we get more done as parents. We can answer emails, put some groceries away, and we have this sort of predictable time periods during the day when we'll have time for ourselves. And so we have to be very careful about that because, again, when you see adults in the clinic, it's not uncommon for me to see a 38-year-old who says, yeah, Chris, my parents said I've been a bad sleeper ever since I was a kid. Well, how did that come to pass? And what was that metric that was used to determine that you're going to be a bad sleeper? And why do you know this? Well, you know it because parents say it all the time in front of the kids, like, Susie, kid, come over here. Oh, Susie, she's the worst sleeper. And Susie's right there listening to all this. So, it's very important the way we communicate sleep to our kids, and we do it in a very, scientifically rigorous place. But if only there were a show in Utah that talked about science, that we could get that message out, right?
Ah, now you're talking.
That's right. Chris, a moment ago, you were talking about birth through 2 years old and what we do to help our little babies go to sleep. We read them the books, we sit with them, and those are the habits that are also, or they're forming habits then. And so give us those tips that, we need to take into the next, say, 8 years until they're 10 years old. How can we reinforce those healthy sleep habits?
That's a great question. And it's interesting. I think a lot of those tips and strategies and things that we put into place when kids are young, they can stay with us our entire lives, not just into sort of the later childhood years. One of the things I talk about with my adults or with the athletes that I work with is, do you have a routine at night? Like when you're driving to some sort of destination, it's so helpful where 10 miles out, you see a sign. Hey, 10 miles, you're Park City. Okay, great. Or we're almost there. Okay, 8 miles, get in the left lane. It'll be a left exit. Like you've got all these indicators that something is coming. It really takes away anxiety and leads to better decision making. And I think that sometimes as kids get older, you get away from, okay, well, we have our meal, and then we allow him to watch a little bit of television, and then it's bath time, and then we read together in his bed, and then we have to tuck in all of his various stuffed animals, and then lights are out. Like there's that little rhythm and ritual of, the child knows that when you're on the 5th book, that's the last book we're reading tonight, and we're scratch your back and say a prayer if that's what you like to do. I mean, all of these things are so helpful. But when you get to see these older kids, it's like AP calculus, chemistry exam tomorrow, and then shut the laptop and try to go to sleep, knowing that if you don't do well on this exam, it could really be a problem in terms of getting into college. So all these terrible thoughts and terrible routines we have, we just sort of get away from. Can we establish a more senior or a more mature schedule for an older kid where, okay, laptops go off an hour before, we put away the Monster Energies and maybe drink water or chamomile tea or something. I've got a rising senior in high school, this big 6'5" guy, and he always has chamomile or passion flower tea at night. It's just a nice ritual that when he smells that and feels that warmth, he knows it's sort of time to wind down. So as parents, we can really help craft these sort of lifelong skills that don't have to end once you've got a little baby sleeping through the night.
It's so interesting. I think about my 23-year-old who, from the time
I've got one of those.
Oh, do you?
I
Oh,
do.
aren't they wonderful about this age? He was always, his circadian rhythm, well, both my kids were that they could stay up till midnight, even as 2-year-olds, and then they would sleep, later than any other kid on the camping trip, right? And what he found as he got older was that, when he started drinking coffee in high school and college, things got worse for him. And he gave up the coffee. And so if at all, ever, and caffeine in general. And so like developing your own sleep identity, your own habits is so important. And, also encouraging those kids to, to do that. I don't know if there's a question in there. I just wanted to mention.
I've got a question for you. I'm going to make a prediction. I'm going to guess that your son is interested in law or writing, like magazine writing. That's my guess. What is he really interested in?
He's a software developer.
Okay, programming. Yeah. So I should have. God, should be my first guess. So I have this belief that a child's circadian rhythm, or anybody's, often pushes them into certain fields. So my guess is your son would be an amazing trauma surgeon, an amazing programmer. They like programming because their boss is going to say, hey, look, we need you to have this program. I don't know anything about programming, so forgive my ignorance. We need this program done by, Friday. The client needs this software patch for this. And so now your son gets to work on it whenever he wants to, not just 8 to 5. So my guess is your son is not going to be a great second grade teacher. I need you here at 6 o'clock in the morning because we have faculty meeting and the kids arrive at 7:30 off the bus. And so it's interesting to me how these rhythms can often play a role in crafting the person we are and what we do. And it's interesting too, kids tend to be more night oriented. And one thing that can really be a problem is giving them sort of no structure to the day, which is exactly what happened with the pandemic. So like you said, when they often have the ability to make their own coffee, sleep in if they want to, some of these night owls can really become quite night oriented. So I would recommend that he date or marry a nice morning oriented young woman, and he'll be just fine, because that's what helped me. For sure. I'm a night person too, but it's nice to have a woman who doesn't really put up with me and says, put your laptop down. It's 11:45. We are going to bed now.
I
Sorry,
love that.
that's it.
His girlfriend's a teacher. So there you go.
So is mine. My wife is a teacher. I think you are set, Lynn. You've got nothing to worry about. So there you go. Time to have good sleeping little grandkids.
Well, Lynn's in great shape. I'm a basket case, so I guess we balance each other out. No, actually, I'm doing okay. But I was surprised by something in your book. It was a Dirk Bach study back in 2016. He found that only 20% of our pediatricians have ever gotten any training for prescribing sleeping pills in children, yet 66% routinely prescribe them. That's kind of unsettling.
Yeah, and I don't want to implicate doctors. I mean, if you want to pick on a doctor, pick on me and watch me try to deliver a baby. I can't do it. I'm an MD. I mean, I'm legally allowed to do it, but I've received no training in it. So we really need to look a little bit deeper in terms of how are we training our pediatricians and primary care doctors? Because as of right now, about 25% of them are getting no training in sleep at all, not just the prescription of sleeping pills. And so, again, we have this intersection of desperate, upset parents and kids in need, and a medical system that isn't really providing the necessary time and support to help these individuals with their problems. It takes time. It's sort of like our town is out of water. We need a dam and reservoir system immediately. Well, that's not going to happen.
Right.
And sleep problems are sometimes like that. My kid can't sleep, or my kid is sleeping through all of his classes. We need help now. Well, that pediatrician's got 7 minutes to get this problem solved before he or she needs to see the next patient just to keep the lights on. Mm-hmm. So it's a system problem, not necessarily a doctor problem, but it is a problem that parents deserve to be aware of, knowing that when you walk out with this sleeping pill that you looked up on your phone that says it's not even a sleeping pill, it's an antidepressant.
Yeah.
Are you okay with that? And are you having thorough conversations about the drugs that your kids are being given? And are you really getting to the bottom of what the problem is? Or are you just stuffing gauze in a wound that's bleeding? You're not treating the wound. You're just keeping the blood from getting on your clothes.
Yeah, exactly. No, we've all heard that Ambien may be addictive. And you say in your book, which was interesting, that there's this relationship between Ambien and sleepwalking. Are there over-the-counter supplements or aids that that are pretty effective, that do not induce sleepwalking or are not addictive?
There's a word that you use there, which is effective. And that's very important. So when we start defining effective, we want to be very clear. What are we defining? It's effective in creating sedation in my children. Does it mean that they're going to fall asleep faster? When you look at the evidence about sleeping pills, you generally cannot find any evidence that would say that pill, whatever it is, over-the-counter prescription, is going to make your child fall asleep that much faster, sleep that much longer. In fact, it's interesting to present that data to children. Hey, did you know this pill you're giving your kid every night is going to make them sleep an average of 3.5 minutes longer and fall asleep an average of 2 minutes faster? Like, that's it. It's not, So, and again, so now we have to go back to effectiveness. What are we trying to affect? What is that change we're looking for? Well, Chris, I've got a kid who won't sleep. Well, no, you don't, because that doesn't exist in nature. So if that's the end point, like it was for Michael Jackson, he didn't think that he slept. So doctors started giving him more and more drugs to make him sleep. Well, that was never the problem that he had. And we eventually killed him. I say we, meaning the medical community, had nothing to do with that. It's just that there was a massive ignorance in terms of what his sleep problem actually was. So effectiveness is troubling with any sleeping pill because they're generally not found to be particularly effective at doing much of anything. And if you define effectiveness as, look, forget the sleep, I just want my kid to perform well the next day. It is spelling test, in his algebra exam, pitching. He's pitching for the regional final in the state baseball tournament. And so listen, Chris, we don't want him taking pills, but he's got to be on his game for pitching. Believe me, I take care of about 30 professional sports organizations. I know all about performance anxiety. So now we're saying we're giving this child a pill to make sure their performance the next day is protected. I'm not aware of any sleeping aids, prescription or not, that have been proven to improve performance. The only studies that I'm aware of are studies that show that they worsen performance. So this whole idea that give your kid this pill so they can do better the next day is kind of a lie. And these are the things that parents are never told. When you're talking about this drug, they're like, I didn't know that this drug that my pediatrician gave me is an antipsychotic. It has absolutely no FDA approval for sleep. And I had no idea what the negative outcomes of this drug would be. We were just so desperate for help because we couldn't find it anywhere that we went along with it. And that's really why I wrote the book. I mean, give your kid whatever medication you want to give them. Just be informed about what it really is and what it's really doing.
Chris, this leads into, I mean, we've broached this topic a little bit, but how often are diagnoses of other disorders really because of a sleep disorder?
Yeah, a lot. And here's where I start to feel a little bit like an imposter, in the sense that I think this book hopefully shines a light on that that's very bright. But there are doctors, sleep specialists that I look up to, Mary Karskeden up in Brown, and a bunch of others who've been beating this drum forever, but it never seems to really get that attention. And she says, look, these disorders, particularly in mental health, anxiety, depression, ADHD, are real. Kids have these disorders. But the massive explosion of these disorders, she always believed, as do I, and many others, that there's a big percentage of kids out there with these disorders that are either being caused or greatly exacerbated by sleep problems that are going undetected and undiagnosed. So I always tell people, look, before you allow your child to be diagnosed with bipolar, ADHD, some sort of cognitive delay or spectrum disorder, talk to your doctor about the appropriateness of a sleep evaluation. And that doesn't necessarily have to be a sleep study. That can just be, I'm going to go sit down with a woman across town who specializes in sleep in kids and talk to her about my child specifically and the symptoms that we're seeing, and ask the question, do you think this could be related to a sleep disorder? I mean, it's shocking sometimes what happens. I have a folder in my office of just letters from parents, teachers, other doctors about kids, once you've treated their sleep disorder, the way they change. In fact, one of the things I had to take out of my book because the publisher said it didn't reproduce well was a letter and a transcript from a patient who sent me a letter when she graduated from college. And she annotated her transcript with our various visits and different changes we made in terms of her medications for a disorder she had called narcolepsy. And you just see in real time her grades get better and better. By the time she graduated college, she was making straight A's. And she said, I would not have made it through college if I had not gotten this diagnosis from you. So credit her pediatrician for figuring that out before she graduated from high school. And it was so important. And anyway, just those kinds of stories are the norm in our clinic, I think, sometimes.
That's so wonderful to hear. Hey, tell us a little bit what narcolepsy really is. All I can think about is it Mr. Bean in that Rat Race movie?
And that's unfortunate. I think I wrote in a book that narcolepsy has been portrayed, I think, about 28 times in movies, and it's always a joke, kind of funny. Narcolepsy is any child who seems to be getting an adequate amount of sleep, but still feels desperately sleepy and tired the next day. It may not be depression. It may not be another disorder. If you're a parent of one of those children, bring up narcolepsy with your pediatrician, even if you don't read my book, just because that diagnosis lag time between symptom presentation and a doctor figuring it out is often averages a decade.
The book is The Rested Child: Why Your Tired, Wired, or Irritable Child May Have a Sleep Disorder and How to Help. Thanks for tuning in to Cool Science Radio.
If you enjoyed this episode, please rate us, give us a 5, and leave us a comment.
Take us along on your next adventure to the moon.
If you have any story ideas, please let us know at coolscienceradio@kpcw.org.
Thanks for listening, and hey, tune in next week.